This is part C explained is this video, and this will be recorded as per normal. And this is our Wednesday night call, 7 p.m. Central Standard Time. So over here, what we're going to do is part C explained. Part C is a Medicare Advantage plan. So Medicare Advantage plan, in order to enroll in an MA or an MAPD, the client has to have parts A and part B on their red, white, and blue card. Okay. So we'll go over the basic information together in just a minute, but let me just kind of walk through exactly what an MA or part C plan is, as they call it. Right. So how do you get it? How can you even get it? Well, one, you got to live in the plan service area. So you can't live in Pennsylvania and get a plan that's in Texas. You got to live in Pennsylvania. You got to live in Pittsburgh to get that plan in that area, in that county. Okay. So that's what they mean by live in the plan service area. Really basic and straightforward. You can't have both a Medicare Advantage plan and a Medicare supplement, right? Sometimes you run into it and you got it and you're just kind of confused. You're like, does this sup even exist? Does it not exist? Does the client even know what they have? So we kind of just go through it and like do our job. So we'll run into it all the time where we see things that can be confusing. The client's confused. They don't know what they have. They think that they have both. They don't have both. And we just do our best, right? We get all the information that we possibly can and do the best job that we possibly can to put them in the best situation. Next, it's offered by a private health insurance company, and it started back in 2003. Not Medicare started back in 2003. Medicare Advantage started back in 2003. And it covers all of your part A and your part B, right? So it's going to cover all your hospital, your part A, and it's going to cover all your medical part B. So that means if you go in the hospital, it's going to cover it. If you go to skilled nursing, it's going to cover it. If you go to see your doctor, it's going to cover it. You go to a physical therapist, it's going to cover it, right? So the plans cover this stuff, and it's called an alternative to OM, which also stands for Original Medicare. Okay, so it is going to be a replacement to Medicare. Okay, it replaces it. It's not, you don't have Medicare anymore. It's not billed to Medicare. Okay. So the private health insurance company gets paid money every single month to manage the healthcare of these Medicare Advantage clients. Okay. So they're not billing Medicare like they would with the Medicare supplement, like what we talked about in our last call on the last video. And that's why on the top line here, it says it replaces Original Medicare. So they don't go and they show one card, right? In the prior video that we did, or last week's call, what we discussed was they have their Med Sup card, they have their prescription drug card, they have their Medicare Advantage, or not Medicare Advantage, they have their Original Medicare red, white, and blue card, and then they have their dental, vision, hearing card, and whatever other cards that they might need. Okay, so there's 4 different cards. With this, it's one card. Right? They got one card, they bring it to the doctor, and that's it. It's a network-based plan. So you have what's called a PPO and an HMO. A PPO, okay, that means that you can go in and out of the circle, right? In and out of the network, where it's an HMO, you got to stay within the network. Okay. So PPO, you go out of the network to go see a doctor, you pay a little bit more money. No big deal. But at least you can go in and out of the network. With an HMO, health maintenance organization, you can't go out of it. PPO, preferred provider organization, PPO. All, as we talked about, right, offers those additional benefits, dental, vision, hearing. It's good. Then there's a ton of different stuff that it offers as well that we can review. It covers prescription drugs. And when I say it can include prescription drugs, what I mean by that is there's a MA only plan, also known as Medicare Advantage only, not Medicare Advantage prescription drug, MA only. So it doesn't cover prescription drugs. And that's for people that are veterans, for example. Okay. So they go to the VA. Low costs, 0 premium. Most plans that we see that we run into are 0 premium. Megan has a killer story, which she's going to tell in just a moment. And she's going to kind of talk about that. And I'll walk her through everything that we literally just went through less than an hour ago. She literally just left that client's house like 15 minutes ago at most. And then what I was talking about next, which is funded by the federal government. So that's very important. What do they have to pay? How do they pay? How does it work? Okay, so it's called a pay-as-you-go system. That's basically what it is. It's like every other health insurance that's in the country, right? It's a pay-as-you-go. For my health insurance, I take out my card, I show it to the doctor, they say, hey, here's your copayment. If I don't go to the doctor, I don't pay anything. You pay it as you go. You go to the doctor, you go to the hospital, you pay. You don't go to the doctor, you don't go to the hospital, you don't pay. It's that simple. So what do they pay? They pay copayments. That's a fixed dollar amount that they pay when they go to the doctor's office, for example. Okay. That's a copayment. They go to a physical therapist, fixed copayment when they go to that physical therapist. They have a deductible. Deductible is $500, for example. Before the health insurance kicks in, you pay the first $500. Works the same exact way for the Medicare deductible, right? Your Part B deductible of $233. And the other thing that they got is co-insurance. So it's co-insurance. That's a percentage. You pay a percentage, not a fixed co-payment, not a dollar amount deductible. You pay a percentage or co-insurance. The plans generally, they're changing year over year, which Megan's literally going to talk about in just a moment. I'll unmute her and we can go over that. She's getting nervous. And it caps out-of-pocket cost. So why is that cool? All right. So that's really good. So one big thing that people who are just, gung-ho on only Medicare supplements, and I talk to these people all the time, and it's not just you sell one thing, you have to be able to provide the service for every client, right? Some clients, it's not a good fit. They just simply can't afford to have a Medicare supplement plan. Okay. And there's nothing wrong with that. And if they can, then what do we push them towards? We always want them to say, hey, can we go towards a Medicare supplement plan if you can afford it? Absolutely. If not, we have an alternative. So what I'm saying, let me just admit this person 1 second. Got 2 people in the waiting room. All right. So when I'm saying that we cap out-of-pocket costs, what that means is they have a maximum out of pocket. That's exactly what it means. Maximum out of pocket. There's a maximum amount that they can pay out of their pocket, right? So if it's $3,900 on an HMO plan, that's the most amount of money that they can pay between their co-payments, their co-insurance, and their deductibles. Okay. If their deductible is $1,000, boom, you paid $1,000 towards that max amount of pocket of $3,900. You get cancer and your cancer treatment is $1 million and your max out of pocket for all this stuff is $3,900. Okay. There you go. Co-payments are included. What's not included in it is prescription drugs, which is another presentation that we'll do on another night. All right. So let me go to the next one here. All right. So who are the clients? Most of us already know who the clients are, but if you aren't aware of exactly how it works, final expense clients are Medicare clients. I do studies all the time. We look at leads. We look at the amount of applications that come in from our final expense agents, our field force that's going out there, sitting down with people and talking to them every single day. And what we found is about 80% of our final expense leads are Medicare clients. So they're just directly correlated, right? They're basically the same exact people. And if they aren't now, they will be in the future. Okay. So a lead's a lead. You have a 63-year-old client. How long do you intend on being in this industry for? I'd assume a pretty long period of time. So that means that 63-year-old client is someone that you're going to pipeline in your CRM and make sure when they're 64, you start marketing to them and talking to them again about health insurance. And as they start to age into Medicare in the next 6 months from there, right? They need help with all this stuff, Social Security, Medicare. You are the person that's going to help them. So when you see someone on a lead card that's 64 years old, that's a gold lead for you, right? That's literally, you're going to get paid twice the amount of money on what's called a true up. Okay. So you're instead of getting paid $287, you get $573 in most states. Some states are $715. It depends. Plus a $50, extra deposit, almost like a bonus deposit, $50 extra cash deposit for a health assessment. So these clients are our final expense clients, are our Medicare clients. The leads, you can mark, the leads are the same exact lead. So the lead doesn't change. Final expense lead is a lead. We also run Medicare leads, so you can use those too. So you can use both of those. And can you market your own book of business? Absolutely. And I already explained why they work together. That's just simply because it's the same exact client. Okay. So MA only plans. This is what I was just talking about for the veterans. All right, y'all. So with this over here, MA only plans, why is this so important? So this is important because sometimes we're going to sit down with people that say, hey, no, I get all my stuff from the VA, for example. Okay. So you get all your prescription drugs from the VA. Yep. Do you go to any civilian doctors? Nope. Okay. So you got Part A and Part B on your card, but you don't use it. All right. Well, here's the good news. In addition to your Part A and your Part B, what we can do, since you're paying that Part B premium of $170.10, is we can decrease that by $100 a month. Basically, what that means, right, is your Social Security check is going to go up by $100. So that is why we use MA only plans. Here's the cool thing about it. Veterans that go to the VA only, right? If they complain about not getting this specific quality of service because it's for the VA for this specific service is not good. Physical therapy, right? It's not good for that. Well, now you have a choice with a Medicare Advantage only plan that does not cover prescription drugs. You now have access to outside providers, right? So you can go see a civilian doctor and sit down with one if you'd like to, go to a civilian physical therapist if you'd like to, and it's going to be covered under your plan with fixed copayments. Okay, so that's awesome because they can now, in addition to that, if they don't get dental, vision, hearing, over the counter, right, with their OTC catalogs, if they don't have that stuff, they can now use it through this plan while also most of the time, majority of the time, probably 95, 98% of the time, getting a reduction in the Part B premium that they pay. But remember, they have to have Part A and Part B to get it. So who are the different people, right? So that's our veterans who use the VA, tribal coverage for Native Americans, group health plans, unions, federal/state, and local governments, government employees. So that is MA only plans, SEPs. These are our special election periods. So where's all this stuff to? Like, well, pause. I'm missing some information. I might be a little green. I'm new to some of this stuff. All this stuff is on the website. It's in FS University. It's on my training. You go to the Medicare agent portal, plug right in, open it up. It's right there for you to go ahead and get all this information. So that way you can use all this knowledge and become more educated, more confident equals more sales. So special enrollment periods. What does this mean? There's a PDF that's in the training that you go ahead and you open up and it literally explains what each one is. This is the reason why a client can change outside of October 15th through December 7th, also known as AEP, or January 1st through March 31st, which is also known as OEP, open enrollment period. So outside of those timeframes, which is 7 weeks plus 3 months, right? About 5 months. Outside of those timeframes, we need to come up with a reason as to why we are allowed to change a client from one plan to another throughout the year. So here's an example of 12 different reasons as to why you can sell someone outside of those timeframes, which is amazing, right? One of the biggest misnomers is, oh, I thought you can only sell them during AEP and OEP. Nope. We could sell these people all year round. We're able to put them from one plan into another. And here's some reasons why. 5-star plan, right? That's amazing. And then also across from a 5-star plan over here is a low performing plan. I believe it's 3 stars or less. We'll double check that in just a moment. Natural disaster declared by FEMA, right? If there's mudslides in California or wildfires, whatever it might be, you can have a freeze in Texas. You can have a major snowstorm, a nor'easter, whatever FEMA declares a natural disaster that generates an election period. LIS, low income subsidy for people that are on a extra help. Also dual, which is dual eligible. So for people that are on both Medicare and Medicaid, it's generally on the same one, LIS/dual maintaining is what it's called. A change of dual/LIS status. They just got it. They lost their dual status, whatever it might be. They lost Medicaid, so they're no longer dual eligible. Chronic condition, which also known as the CSNP, chronic special needs plan. That's for diabetics and for people with heart issues. They moved from Pittsburgh, Pennsylvania to Texas, which is the reason why I keep saying that is literally a client that I have did it. They're institutionalized, right? So they've been institutionalized and they are now eligible for a plan that is for institutionalized individuals if it's available in your area. SPAP, so State Pharmaceutical Assistance Program, those members of it or loss of SPAP, which pretty much anyone in any state can usually enroll in them. You just Google it, figure out how to enroll in a state pharmaceutical assistance program. Trial period. This is one that Mike's actually going to talk about. So I'm going to give a little note there on trial period. And Mike, you can kind of run through that one, which is important. Low performing plan, which we just went over, loss of employer coverage, and then on Social Security disability, but you aged in. So let's say, for example, they were 63 years old and they been on Social Security disability since they were 60, right? They've been on it for a while. They aged into Medicare. All right. But right now, since they're 62 and they aged into Medicare because they had it when they were 60, so greater than 24 months, and they're automatically enrolled in Medicare regardless of age, right? But now they turn 65, it gives them another election period, right? So Mike, you're unmuted. Do you want to go over that trial period real quick?
Yeah. So the trial period, the way it works is that if you go with a Medicare supplement plan, right out the bat, let's say when you turn 65, a lot of people like to do it because it's very inexpensive. At least out here in Arizona, you can get a Medicare supplement plan typically for about $100. But as you get older, the rates start to go up in price. And if you have health issues, you can't change. And so the only option you have to do is to go to a Medicare Advantage plan. So what the trial period does, it allows you to try out a Medicare Advantage plan for up to 12 months. If at any point in time throughout that 12 months, you aren't happy with it, it doesn't work like you thought it was going to work, then you can go back to your original, the plan that you were on previously. And no questions asked. It's guaranteed issued. Get back on that, the prescription drug plan that you had as well. Now, just one of the loopholes that I noticed with this is that they don't ever check to see whether or not what plan you're going to go back to. So what I always kind of do with my clients, especially the ones that love the Medicare supplement plans, and they've been on it for years, let's say they're paying $280 or $300 a month, which you'll run across those quite often, is use that trial period. If they like it, which typically most of mine will, though, they'll like the Medicare Advantage plan, so they don't end up switching back. But if for whatever reason they want to switch back, I'll sign them up with a new company, get them that rate, that much cheaper rate that they were originally wanting anyways. And so now I can reduce their cost down to like 140, 150. And now they're starting that process all over again, where they're going to get those rate increases on an annual basis. But at least they got a much cheaper price. And so you're doing them a real huge solid by doing that. Like I said, I was told that you weren't supposed to, but again, it's available for you. You're helping them out. And I always try to make sure I help my customers out.
Yeah. One question on that. Do they have to go back to the same company that they were on prior?
Well, again, that's what they want you to do. Yes. But sometimes let's say that plan isn't available anymore, or that company's not around anymore. And if that's the case, then you can put them with anybody that you want. And, again, you're always going to try to get them the best rate that you want. So technically, yes, that's what you're supposed to do. Now, what you do with that is up to you.
Okay. Yeah, no, of course. And then let me ask you a question. When you're filling out the application for the Medicare supplement, right, to put them back on it, what option do you select for them to, is there just a button that they check and box that says trial period, or how do they know?
Good question. Yeah, there's a guaranteed issue, like right at the very beginning, it asks you whether or not it's going to be an underwritten or guaranteed issued. You're going to choose the guaranteed issued. And then when it asks you for the special enrollment period, you're going to use trial period for the special enrollment period.
Okay. That's good. That's good.
What you pick for.
Awesome. Hey, Scott, just save your question.
Just to hit up one other thing too for you is that I just noticed here that Aetna came out with the special enrollment period for the state of Arizona. Apparently there's some fires going out in Coconino County. So, again, you get the special enrollment period. So you always got to pay attention to what's going on. So that way, what you can take advantage of.
That's a great point, actually. And that's why I do this just inherently. I literally will scan through every single email that I get. I don't just swipe and delete them all. I think you like on my phone, I swipe left and just delete an email when I know it's junk mail. But if there's anything coming in from insurance carriers, I am always reading it real quick, especially if it says SEP special enrollment something, and then I'm going to forward it to the agents in that area. So that's important. So I know we got hand raised. We'll finish this up and then we'll take some questions. All right. So let's go to the next one over here. All right. So this is what we were talking about by benefits beyond original Medicare. So we have benefits beyond original Medicare. What are the benefits beyond original Medicare? What does that mean? Okay. Original Medicare pays 80% of the bills. Okay. What does it not cover? That's why they say benefits beyond original Medicare. Of that, we have dental, vision, hearing, transportation. We have healthy food card, foot care. We have chore and personal care services, over the counter. We have Go 365 meal benefit, Go 365, which is a program by Humana. We have a meal benefit, and we have PERS, which is personal emergency response system, which is like Life Alert. They got a free gym membership with most plans. Bug spraying service. Yes, I've seen that with a plan in my area. It's like, what the heck? Which makes sense, though. It was on a dual special needs plan. And the reason why it makes sense is because we want to keep people healthier. And if they have bed bugs or cockroaches running around their house, it's generally not a cleanly environment. So their quality of life is decreased. Therefore, they could die sooner. So the actuaries, right, or the number crunchers, they want to figure out, how do we keep these people staying alive longer? Well, here's some good options we can provide to them. Let's make sure their teeth are in good shape. Let's make sure they got good vision so they don't get into a car accident, right? And something along those lines. Let's make sure that they can hear so they're listening. Transportation, that's important. We want these people to have the best quality of life and get to the best physicians. So let's make sure they have transportation. Healthy food card. What does that mean, healthy food card? Well, that's actually exactly what it means. It's a card that they go swipe at the grocery store. That's a prepaid card. They have foot care, right? They can go to podiatrist, have foot care. That's amazing. Chore and personal care services. That's literally exactly what it sounds like. Someone comes to the house and cleans and helps them clean. Over-the-counter items, if you haven't seen that, that is exactly what it is. It is over-the-counter. Anything that you see in the pharmacy aisle, those 6 to 8 aisles at Walmart, that is indeed covered right over there. The next thing that we have here is Go 365, which is a program by Humana that is, you get paid to do the things that you should be doing. So let's say, for example, the client goes to the gym, right? Well, they actually pay you for going to the gym. They give you a gift card, and that gift card is going to be for different things, such as, you could use it for Walmart, Target, CVS, all these different locations, Texas Roadhouse, right? If you want, go to a food place and they'll give you a $20 gift card, etc. So you look that up, or send me an email, and I'll send you the email with the Go 365 information on it. Meal benefit is similar to the healthy food card, but the meal benefit comes when you get out of a nursing home. PRS, I just explained, gym membership, bug splaying, flex card. That's a big thing with WellCare. Mike, can you unmute yourself and can you walk us through that flex card and how WellCare does it? I know you sell them a lot. So yeah, go ahead.
WellCare is big, and with these flex cards, and depending on which area you're in, they've seen them as low as $50. I've seen them as high as $1,500. And what that does is that's going to give you basically an extra $1,500 or $1,000. That's the most common one, though, of any extra dental, vision, or hearing. So most dental plans, they're going to have a cap on it. Like, again, WellCare, depending on the area, it's anywhere from $1,000 to $3,000 worth of dental work. Well, the way it did work last year is they actually covered the first $1,000 worth of dental coverage. This year they changed it where they pay 60%, you pay 40% of the cost of any dental work. So they give you this $1,000 flex card that you can use to pay for those extra costs out of your pocket. So you're not actually having to pay for any of that work. Or, if you wanted to get some vision, they'll give you like $200 worth of vision. Let's say your glasses are going to cost you $500. You can use that flex card to pay for that. And then the hearing is usually about $1,500 in total for your hearing aids for the year. Obviously, hearing aids are pretty expensive. So you can use that $1,000 flex card to cover that as well. And they'll even add on, depending on if you have a chronic illness, they'll give you an extra $50 for food. They'll give you an extra $50 to pay into your utilities. So they give some really nice programs, nice things that the client really likes. And it comes on a regular Visa card for you to use. So it's, pretty cool.
And now with these benefits beyond original Medicare, right? Every plan is going to have different benefits. We know that, right? No plan is going to be the same as another plan, even within the same company. They're all going to vary. So these are really your selling points, and these can be pain points for clients, and pain points is what we sell on, right? So kind of walk me through how you would, kind of pitch to a client why some of these benefits may be better than other ones, or how you would explain, why this is worth their while to even have a plan like this.
Well, and that you're absolutely right. These are kind of the things that you're going to highlight to sell your product over what they currently have. So, the way we're going to go approaching these typically come off a final expense lead. So you're going into the house to sell them final expense. When I get to the point where I'm asking, where you're explaining what I do for a living, I tell them I'm a broker, but I'm not your typical broker. I don't just sell, 30 different life insurance companies. I also help people with their with their Medicare. I help people who are under age 65. I help, and I go into all the different items that I can help them with. And then I start asking them the questions about their Medicare. And this is where you kind of find out who they have. A lot of people have United Healthcare. Well, one of the things that I know with United Healthcare, at least in my area, they hadn't made any changes to their policy in a while. So they had still a $5 copayment for their primary care, and they had like a $45 copayment for the specialist. Well, there are tons of companies that had way better benefits than that. So I know right away, I'm probably going to want to look at maybe a Humana or a WellCare plan. And again, when you know that's where you're going to go to, because they're going to be able to use those same doctors, then you just kind of go through the highlights. I start using, I like the WellCare plan the best because, let's face it, you're living off a fixed income. You could probably use an extra $50 off your utility bill. And they're like, well, yeah, that $50 means a lot to them every month. And then you talk about the food card. You're going to get that $50 food card. Well, that's $50 less you have to worry about going out to buy your food. And so you just kind of make sure you position it with them. But it's all about asking the questions, doing the research. And I know that Holden has, and I have a worksheet that we give out to our agents to fill out. So this way they can fill this sheet out. They just ask them questions. And this way, if you have any questions for us, you can send us over this worksheet and we can take a look at it real quick and know what we want, which direction we want to go with this client. We have a pretty good idea where we're going to go. And so that's something nice. And that's going to give you guys the questions that you need to ask during your phone call. And it's going to help you know what other options you have besides final expense. You can help these guys, and you're going to be able to find out, hey, dude, how much do you get from Social Security? If you get, if you get like, under $1,500, that they're going to qualify for extra help. If they get under $1,100, that they're probably going to qualify for Medicaid. And when you start doing these things for the clients, then they really start to love you, because it doesn't take much time or effort to go ahead and fill out an application for those extra help. But yet you're putting an extra $170 in their back pocket, which is huge for them. And so, yeah, it's a lot of information that we're giving you, but we took a lot of the guesswork out of it for you too. And we have a system in place that if you guys just ask the right questions, you fill out this worksheet, you call in for help, you're going to be able to be real successful at this, and you're going to learn a lot quicker too.
Yeah, shortens that learning curve, which is kind of the most important thing for us. I mean, that's like very, very crucial. So love that. And it could be like the slightest of things, right? It could be that their doctor doesn't take an Aetna HMO for dental, right? That they need to have dental work done, and Aetna happens to have a PPO, and now you're the agent of record, you're getting paid the commission, and you're using the same exact insurance company. You're just putting them in a different plan, or you're switching from one plan to another, right? They decide that they want a plan that has transportation, whereas their current one doesn't. So these are all different reasons as to pain points that they could have, right? Some of our clients just don't drive. So like Mike said, right, use this stuff to your advantage. It's inside the plans. Use it to your Medicare advantage. Just kidding. All right. So is a cheesy Medicare joke. All right. So when can they enroll and their enrollment period? So we have an SEP, special enrollment period. These are special circumstances that allow you to sell all year round, which we covered a couple slides back. AEP, October 15th through December 7th. OEP is open enrollment period. They used to be used synonymously, but they split them back up again. So you have to use them differently, right? So AEP, annual enrollment period, October 15th through December 7th, open season, open enrollment period. If you got a Medicare Advantage plan, you can make one change during that time frame between January 1st to March 31st. One change if you have a Medicare Advantage plan. Newly eligible, what we call T65. So that's 7 months. Let's say for me, I'm born in September. So 3 months before my birth month, okay, then September, then 3 months after my birth month, October, November, December, right? So 3 before birth month, 3 after. ESRD, end stage renal disease. If you see that on the Medicare worksheet, made some updates to mine, by the way. So I'm going to be sending that out with a couple updates. I added county in there, and I got rid of something else on there. So ESRD, end stage renal disease, that's permanent kidney failure treated with dialysis or a transplant. Okay. So if they're on dialysis, right, that's one reason as to why they can change, right? They began dialysis or they had a transplant. And that's how they were treating it for their ESRD. Receiving Social Security disability income greater than 24 months. So I tell the story all the time. I have a lady that calls me, and she calls me every year or so. She runs a household for disabled children, and every 24 months, she calls me on up when one ages into Medicare, because they've been receiving Social Security disability income for greater than 24 months. They're automatically enrolled. She calls me on up. Hey, so-and-so is 16 now. She's been on, Social Security SSDI for 24 months now. She just got a red, white, and blue card, calls me on up. Boom. We go ahead and we meet, we sit down, we do whatever we need to do to get the plan done. So I help her on out with that. All right.
You know what I noticed too with that whole thing? Is that when you first enroll them, when they qualify for Medicare, you get paid as a true up. And then when they turn age 65, you would still get paid as a true up again. So you actually get paid twice. So those are really nice customers to get.
Double dipping.
Yeah, double dipping. It's always
we got to use the system to our advantage too, right?
Yeah, exactly.
So that's to our Medicare advantage. All right, I'm done saying that joke. All right, so yeah, no, definitely. All right, so that's something that's super important, guys. So remember, it was the scenario we were talking about before. So why select it? Here's the good, like what we were talking about, max out of pocket. Okay, $3,900 with an HMO, $6,700 with a PPO. Okay, generally speaking, a PPO's max out of pocket is going to be higher than an HMO because it costs them less money to keep you within a network. Okay, costs them less money. It's a pay-as-you-go program, like we talked about. You go to the doctor, you pay. Okay, you don't go to the doctor, you don't pay. You get hospitalized, you pay. Don't get hospitalized, you don't pay. You don't use the plan at all, right? You're as healthy as can be. For 20 years, you haven't paid a dime if you have a zero premium plan. That's a tremendous benefit. But I will remind you that you need to check in with these clients every year because plans change. Okay, and we get this information before, and we know what to do. Low cost as far as prescription drug goes, so that's pretty cool. Tier 1 and tier 2 with most companies are $0. That's right, $0. Doesn't cost them anything. Doesn't cost the client a dime. They get it through the mail, 90-day, 100-day supply. With UHC, it's 100 days. They get a 100-day supply sent to them for tier 1 and tier 2. What is tier 1? What is tier 2? What does that stuff mean? I'm glad you asked. In the training, we do have a part D portion of the training where you can actually stop and watch the video. I'm not going to get in the weeds of what that means, but it's generic and brand name drugs. So benefits like we talked about beyond original Medicare, limited co-payments. You go to the doctor, all you pay, $20, right? When you go see that specialist, that's it. That's what your co-payment is. You don't get a bill for anything else. Low premium to no premium, basically $0. No underwriting. If someone's as sick as can be, there's no underwriting. In fact, there's plans designed for people that are very sick, that have heart issues, right? That are diabetics and have diabetic neuropathy, right? There's plans designed for people like that. So there's no underwriting. Access to large networks, especially for those on Medicaid, a little bit large networks, which is pretty awesome. Plans designed for clients' health, like what I was just talking about with the no underwriting thing. Insurance company deals with the providers, so the client doesn't have to. Another thing that's important that y'all need to pitch is they have an agent that's actually fighting for them. That's a huge thing, right? That is a big thing. Someone that's local. They don't got to press 1 for English, 2 for Spanish to get someone into you that doesn't, speak their language. They're confused. They're seniors. They don't like to be confused. They want to pick up a phone, call someone answers. That's it, right? There's no wait time. They call us, we answer. If I don't answer, Miss Mary, please leave a voicemail. I'm going to get back to you as soon as possible because I'm probably helping someone else out like I'm helping you. Okay, so just give me a little bit of time. I'll get back to you. Please don't get nervous if I don't answer, but I'll call you back as soon as I can. Includes prescription drugs for the MAPDs, and you only got one card, like what we're talking about. Here's the bad and the ugly. Prior authorization for medical services. DME, which is durable medical equipment, surgery and hospital stays. What does that mean? If you're on a Medicare supplement plan and you have original Medicare and your doctor says you need hip surgery, you get the hip surgery. Okay. Medicare or your health insurance company, they don't fight it. Doctor says you need it, you go get it done. With a Medicare Advantage plan, if you need hip surgery, the doctor says, hey, insurance company, this client needs hip surgery. And insurance company says, hey, do 12 sessions of physical therapy and then come back to us and tell us you still need hip surgery. That's called prior authorization. So DME, durable medical equipment, oxygen tank, stuff like that. So different medical equipment that our client might need. Network limitations, right? Like we were talking about, it can be limited within a network. Referrals, you need a referral to go see one doctor, or, if your doctor says, like today, Megan, you and I were just talking about, right? Hey, we got to get you to that physical therapist because you had a car accident. We need to give you a referral to go see them. And referrals are actually really easy today. They're really not even difficult. Most of the time, the doctors don't even make you go see them. They just, call them, hey, I'm having this type of issue. They know your medical history. You've been going to them for 20 years. Yeah, I'm going to give you referrals. Really simple. And like what we talked about before, can incur co-insurance, co-payments, deductibles. That's about it. SOAs, PTCs, and BRCs. Those are important terms for you to really understand, and they're important forms. Scope of appointments, permission to calls, and business reply cards. We got BRCs, business reply cards. That's our leads. Scope appointment you do in Sunfire, and PTCs. If you need them, I'll email them to you. Permission to call. So here's an SOA. Here's a scope appointment. This is what it looks like if you've never seen one. Okay, here you go. Front, or actually it's generally 2 pages. Yeah, so page 1 of 1, 2 of 2. But we do it all in Sunfire anyways. So that's that. This is a business reply card, also known as a BRC, that they send back. Or is this, let me see. Yeah, no, this is a PTC. This is a permission to call form. I had to read it for a second. So this is a PTC. I understand that person who will be discussing plan options may be compensated based on my enrollment in a plan. So this would be an example of that. And then next over here, important changes in Medicare would be a business reply card. All right, so we got that done. Now we had 2 questions, Renee Barker and Scott Bryan, and then I will go ahead and do that. Mike, while they raise their hands, some stuff that you wanted me to go back to or add to that?
Yeah, with the scope, like you were saying before, just make sure you guys get familiar with the Sunfire. It's a great tool, and it tracks everything for you. It attaches it to the applications for you. So if you ever do get a complaint, one of the first things they're going to ask you is send over the scope. And so, you know, back in the day, it was hard. So you got to keep a file, you got to keep a scope in there, and you got to keep it there for 10 years. Now, if you just do everything on Sunfire, it's all done for you. And so if you guys aren't using it, or you're not sure if you're using it the right way, reach out to one of us. We can certainly help you with that, because it's a great tool that we have, and it logs your clients, logs all the information, their history, their doctors, their prescriptions, all that stuff. So, you know, once you put them in the system, you shouldn't have to ever worry about putting that again. And it makes it a lot easier for you to rerun quotes, especially when we're coming up. I mean, AEP is just right around the corner, and it just makes your life a whole lot easier.
I completely agree. Yeah, we get that stuff done, and we get it done quick. So let's go to, we got 2 people with raised hands. Scott, clicked yours. Renee's got her hand raised too. Next. All right, Scott, go ahead.
Yes, Mike, I know you talked about the trial period, and the quick question I had was, and I know you said that most likely if they go through the trial period and you put them on a Medicare Advantage, they'll probably just stay there. But if they go back, and they go back to the original plan, are you still their Medicare agent, or is the other Medicaid agent still going back to there too?
Well, that's a good question, because I've never put them back. I've always put them back with another carrier, you know, because a lot of times they're in a different, those plans aren't available anymore anyways, because, you know, a lot of times people are on a plan F, they don't do plan Fs anymore. So, you know, again, you're going to be able to put them with a different provider. But I believe, though, the answer is if you put them back with the original plan, then they're going to go back to the original agent as well.
All right, thanks.
Yep.
Absolutely. And we got next over here, we have Renee. Miss Renee should be unmuted. Yep. Okay, you are good to go.
I have a couple questions. One, with the scope of appointment. Every year when we do our review with our clients to check and see if there's any changes in the plan, or if we need to move them or whatever, do we have to do a scope of appointment each year?
Just get them signed when you're meeting with the client. Yeah. So always just get a scope signed. It's the easiest, most simple thing in the entire world. So when you're sitting down with someone, just get it done. It takes 2 seconds to do in Sunfire.
Okay. And then the permission to call forms, do we have to get those from each of our clients?
No, that's not a requirement to get that. That's if you're sitting down with someone, they are not your client. You can get what's called a PTC, or permission to call form, to give them a phone call back in the future, right? If someone is your client, you are allowed to market non-health related products to them, aka life insurance or other products. You're allowed to do that. They are your client. You can market to your client, and you can call your client at any point in time. That's for someone that is not your client. So you can get a stack of those PTCs, call them on up, you know, so it's up to you.
Okay. And then my last question is there a way for us to get like on a Medicare notification list, like for the SEPs and stuff like that?
The insurance carriers email every single SEP out there to you. So that comes directly from the insurance carriers. There's no list or anything along those lines. That comes directly from the carriers. They'll send you an email. Every carrier, I get emails all the time. Whenever I get them, I'll go ahead and I'll forward it to to everyone that's like in that area. Like Mike was saying, it's in Arizona, so I'm not going to send, you one that's in Arizona. But whenever I see it coming on in, it comes to me. So I'm sure it's coming to y'all anyways, because I'm not anything special, right? We're all just numbers to a lot of the big insurance companies. So that is the answer to that one. Who else we got? Or that was it. Okay, cool. So that's it for Renee. You muted yourself again. All right. So Megan, I hope you're ready. Got a couple questions for you. All right, Megan.
Okay.
All right. Here she comes on. All right. So Megan, today you were out in the field. You walk through the proper steps and procedures every single time you go out there. You're sitting down with a client. You always do all of the right steps. You're going into Sunfire. You're putting the doctors in. You're putting the medications in. You're using this form right here that I'm gonna do a little screen share on, which y'all should be able to see it. I hope you guys can see it. Mike, can you see it? Megan, can you see it? The Medicare worksheet. Okay, you can. So you always do all this stuff. You take the proper steps. You do a phenomenal job with this stuff all the time. And today you did it again, right? You go ahead and you call me while you're in the home. We're looking at everything, seeing what we can do to help these people out with their health insurance. And it turns out that these people were paying how much were they paying a month for Medicare Advantage plans?
So the husband was paying $145 and the wife was paying like $135.
$145 for the husband, $135 for the wife. So that is a total of $280. $280. And just to be clear, I want to be clear about this. Those were Medicare Advantage plans, not Medicare supplement plans, right?
Yes, they thought it was a supplement plan. So I thought it was too until I got their card, their Aetna card, and then I saw it was a Medicare Advantage plan.
And when you were walking through this, how did you figure out, how did you know how much they were paying? Where did you get the information from?
So I put the zip code into Sunfire and then view all plans. I unchecked the appointed one, found their previous plan, and then got the details on there, and then just compared with the one that I know is really good in my area.
Okay, cool. Yeah. And you know the plans because you're running into them all the time. You're sitting down with people and you're always selling them out there doing it. So you get this information, you're looking at it. And not only that, but there was another big issue that the clients were having. One was the prescription drug. So they had a drug and they were paying, what was it, $185? The guy said every 3 months.
It was $185 every 3 months. Yeah.
And how much did you get that down to?
It was $35 a month.
$35 a month. So that's 105 for every 3 months. So you saved him another $80 there times 4, right? So we saved him another $320 plus that $280 a month that you saved them. So 280 times 12, we saved them $3,360 plus that $320 just on those drugs. And I'm pretty sure overall you saved them more money on drugs, right? Right? I know.
Yeah.
I'm not sure about
when
that.
I did the drug comparison, it said that the Aetna plan was $12,000 for the estimated cost throughout the year, and UHC was like $1,000.
That's actually really, yeah, that was a really good point actually, because that guy was saying that one drug, that thyroid medication, went up throughout the year to like hundreds of dollars once he hit the donut hole, right? Wasn't he saying something like that?
Yeah.
Okay.
Yeah, it gets to be an insane amount because they can't do the generic for that.
So you sat down with them, and then you and I, we were talking with them, helping them out and everything. What for the clients, right? Obviously, right, that's a tremendous amount of money. I'm assuming, right, when you leave someone's house and you take that $3,680 plus all the other money that you saved them, but let's just say it was just that amount. You leave a house, you save someone $306. They were pretty grateful for everything that we did, right?
Oh yeah, they invited me back to come for dinner later on.
Yeah. So, okay, there's a prime example, right? How many of your clients slammed the door in your face? Megan's getting invites to come back to dinner. Next thing you know, it's going to be their granddaughter's wedding, and she's going to be selling this family insurance forever, so it's going to be great, which is phenomenal. So that's like a really great example. And I'm probably missing some stuff on this, but what other things would you say that were really important to kind of help this sale go through, right? The money aspect was great, obviously. What other things really helped you make the sale?
So a couple of things was just when they had Aetna before, so whoever they talked to told them to rip up their red, white, and blue card, that they never needed it. So when I like made a face when he told me that, I was shocked. So that was a big thing for them. I mentioned the over-the-counter card because Aetna didn't have that available with that plan, so that's an extra $40 in their pocket every 3 months. Yeah.
So 40 every 3 months, right? So that's another $160 you just put in their pocket. Now our total's up to $3,840 just with those ones, plus like you just said, with all the other drugs. Now, oh, and they had a dental bill for what was it, $24,000?
Yeah, some dental bill that was $24,000 and Aetna only paid $150.
Yeah, which is crazy. So we ended up going with a AARP United Healthcare plan. That was, how much was the premium on that plan?
That was $0.
$0 premium. So we saved them just before we even did anything. And this was the big thing that, I was saying too. I was like, hey, before we even did anything, let's just say Glenn and Linda, hey guys, Glenn, Linda, if everything stayed the same, your prescription drugs stayed the same, right? Your dental stayed the same, your vision stayed the same, your over-the-counter stayed the same. If everything stayed the same and they were apples to apples, literally, and we're just saving you $280 a month, does that not make sense for you to kind of do something along those lines and to look at it, right? So that is a tremendous thing. And now Megan's literally going there. She's got dinner for months now on these people. She's going over every weekend, going to hang out with them. They're best friends now, right? So that's a huge thing for you, Megan. And this isn't the first time you've saved people money, right? I mean, you've done it many times now.
Yeah, I've done it a couple times now. Last week was the week that I think I saved the guy $100 a month.
Yep. Yeah, I remember that one. $101 a month. And the guy had a prescription drug plan. And you know what? This is actually a really good question because you and I were talking about this. One of the main reasons why we're able to save these people so much money is because they don't make any changes, right? I mean, these people must have been in this plan for at least like 2 or 3 years. I'm pretty sure they hadn't changed. Well, I asked them, right? I was like, you probably haven't changed since you've been in Medicare. And they said, no, they hadn't, right?
Yeah.
So, I mean, that's huge. And that other guy that we were talking about, you saved $101 on just having a prescription drug plan. That was a guy that was in Medicare since 2017 and never made a change because he just said he never got around to it. And luckily Megan's able to get in the house, sit down with the guy on an appointment and talk to these people. And she just does this. Look on on my screen, if y'all can see it, the Medicare worksheet here. She just literally just fills it out, right? She just fills that out, gets the information that she needs. And then we go over and what it does. And Megan, this makes my life easier and your life easier, right? It expedites the process. So you get all the information, you're fact finding, right? You get Mike and I, right? You get us over the information. And what happens when you get us the information is we're able to now be more informed on the situation. So we're not scrambling while we're on the call. And now it establishes you more as an expert because you've already done your legwork. And you're like, boom, you were the one. I wasn't even in my office when you sent it to me. You were the one pulling it up in Sunfire. And I'm looking at the text message and it's like, boom, hey, here's the plans. Here's the comparison. Because when she told me that, I couldn't believe it. I was like, no way they're paying $135. And sure enough, she screenshot and sent it to me. And I'm like, this is insane. And I had to tell the clients that. I was like, honestly, I didn't believe her at first. That's what I told them. I was like, I didn't believe her at first. But you did the legwork and you did a tremendous job on it. So thank you. Thank you once again. Is there anything else you want to add to that?
Well, I would like to add something.
Yeah, go ahead.
Now, Megan, if I'm not mistaken, I think it was around this time last year, you were kind of struggling a little bit, trying to find your way. And then you just adopted into the system that FS has. And you just seen your numbers. Now, I think we would all consider you an elite producer, right?
Yeah, maybe. I don't know.
I do.
I do.
Yeah, I was struggling to find my way May of last year. And then I kind of took off in the summer a little bit with final expense.
With final expense and now with Medicare, you're doing. So it's great. I'm glad to see it.
She is slinging Medicare. I'll tell you, I mean, I can always tell, and Mike, you can always tell, right? How often agents are sending you, texting you, and calling you. That's how you can tell how frequently someone's working. Megan, you are always sending me these. You're doing a phenomenal job. I mean, keep up what you're doing because it's clearly working. And she's out there saving these people a ton of money, and then they love her. And the byproduct of that, sooner or later, starts to hit is referrals. Hey, can you help my mom and my sister, my brother? And she was, it's funny, Megan, the funny thing about this was she had said that her mother's 88 years old, and she said that her mother hasn't had any medical bills or anything. And when I asked her the name of the company, what did she say the name of the company was?
AARP.
Yep. And the next thing I said to her was, so, and then I literally said this, I was like, so why don't you have AARP? And then boom, she was like, I don't know.
Well,
I should have. No one wants to listen to their mom when they're an adult and their mom's 88.
Well, the funny thing too with that one is when I first showed up, the daughter called Linda, which is the client I was sitting down with. And the daughter, she was like, oh, I've got this insurance lady here with me. And she was like, what company does she work for? I said I was a broker, so I worked with all of them. And her daughter told her, don't get UHC. She said, it's the worst one ever, but she lives down in Tennessee. And I said, different plans, different zip codes, you never know. And yeah, ended up signing her up for UHC.
Yeah. And the good news is, and this is the thing that we explain to everyone is, hey, we work with all companies. I don't care what the company is. Our job is to make sure you, the client, are in the best plan. And I tell that to every single person. Whenever you're on the phone with me, Megan, when you're in the home, do I not tell these people that all the time? I don't care about the company. I care about the client.
And I actually use that line. So I usually say it first. And then when I get you on the phone, then you repeat it. And then they like look at me and they smile and they're like, yeah, that sounds familiar.
Yep, exactly. And it does, it really solidifies everything that we do. And that's the thing that, we love to do. I mean, I absolutely love taking those calls and just making sure, because it really solidifies the deal. Right. And then, you'll have clients that call you all the time. And it's always helpful to have someone that you can, ask these questions to. And that helps make sure that you are getting the correct answers to your client. So you're not someone that says, hey, rip up your red, white, and blue card. Right. Like that's definitely not the right thing to be saying to clients. So
which he did actually rip it up. And so when he showed it to me, there's a piece of tape over it because he thought about it. He's like, that doesn't sound quite right.
Yeah, he started ripping. He's like, I don't think I'm supposed to do it. That's funny. Cool. Well, I appreciate you. Thank you for not being shy and letting me unmute you. Thank you so much. All right, cool. So we have some other stuff to cover. We do need to cover the Blitz review as well as we go to wrap up the call here and the basic information to gather. So we got to the end of the call, but if you go to my website here and we look at the Medicare worksheet, you can go ahead and click this Medicare worksheet. It'll just open it on up for you, which is exactly what we're looking at here, but got all the training right here. So here it is. So you just go ahead, you fill this information out, you ask questions, and you write down information on here. And that's how we're able to stay well informed. What's your prescription drugs? What's your doctor's, your specialist, any additional notes, client signature, date, all that different stuff. It's important to make sure that we have this stuff and get all this information now and in the future, right? This isn't just, we're not just wham, bam, thank you, ma'am, selling these people, and then we never see them again. No, they are our clients, they're our clients for life. We paid for a lead. We sit down with this client. They love us. We want to make sure that we're able to take care of this client for the rest of their life. Someone in the waiting room. For the rest of their life, we want to make sure that we're there to help them out. And that's literally our job and our responsibility. So that's the basic information to gather on there. Their red, white, and blue card, their current health insurance card, their doctors, their prescription drugs, date of birth, zip code, and county. And that's really it. I mean, you can literally get rolling with that stuff, which is all on that worksheet right there. So Mike, what else do we add to what we were just talking about? Basic information to gather. Why is it so important to use that Medicare worksheet, stuff like that? And if anyone else has questions, go ahead and raise your hand.
Well, yeah, and I love the worksheet, and I always make sure when you're doing your fact finding that you ask all these questions, because I don't know if you guys noticed, but I sell a lot of different products. And the reason why I sell a lot of different products is because I use these worksheets. And, I ask all the questions, and I feel that I can go into any house and I can sell them something. Now, I don't sell every person I come in contact with. I wish that would happen, but I know there's at least a product I can offer them. And so even if you're not, let's say you're doing Medicare and you haven't jumped over to the annuity side or doing ACA, at least now you're going to have some information on this client. So, hey, I need to circle back to this guy because this guy has a 401k from his work and he's been retired for a few years. And, we could do something with that. And there's a lot of opportunity there where you can help these clients out, especially the way this economy is. I mean, you can really help them out. You can do them a huge favor by saving them from losing money, and you can put some real good money in your back pocket too. Which, let's face it, that's what we're all here to do, is make some money.
Yep, exactly. I mean, literally, Megan saving someone over $300 with everything she did. It was probably closer to $400 a month, right? And at the end, actually, over there, she was actually talking about how these people lost everything in the 2008 recession timeframe. They lost all of their retirement accounts. They said they lost everything. So for her to come in and save these people $400 a month, that's just like mind boggling. And it's not like pie in the sky either. I mean, Mike, do you not save people money all the time?
All the time. I mean, just this, I can't wait to ding this tomorrow. A guy I saving $1,800 a month. And this, what we're going to put together for him. We're going to get his retirement package put together. We're going to get his life insurance together, some term together. I mean, we're going to probably spend about $1,100 of that, still saving him $700. He's super happy. His wife's super happy. I'm super happy. It's really a win-win situation. It's awesome.
That's what makes the world go round. We're literally out there helping people, and the byproduct is that we make money. There's literally no better business, because there's so many industries and so many different businesses where you actually have to like take advantage of someone to like make money, right? There's so many different, and this is like, Megan just walked to that house, sat down with that person. By the time she left, she saved him over $400 a month with everything that she did between prescription drugs, monthly premium, everything. And then it's like, hey, let me help you take this money and use it towards other things that that you need, right? So that's important. And then, hospital indemnity plans. All right, so raise some hands if you got questions. And then Mike, if you want to cover, if anyone, let me check the chat. If anyone's got any questions in the chat, which I don't see any questions in the chat or anyone raising their hand. Do you want to cover the blitz real quick? You're doing ride-alongs with people. I'm pretty sure you're maxed out on ride-alongs, right?
No, I don't think I am yet. So, well, if you guys want to do a ride along with me, let me know, and we'll figure out a way to get as many people for you guys to ride along with me, because I think this is going to be a great opportunity for you guys to see exactly what it is that I do, how I go about doing it. And so I know I got a lot of leads that I'm going to work. I got an appointment setter that's going to book me up appointments all week long. And this way, if we have to, right now, I have it set up where I have someone riding with me the whole day. But if I need to change it up, where I have somebody riding with me in the morning, then someone riding with me in the afternoon, hell, even if I have two people riding with me, I don't really care. It's an opportunity for you guys to at least get to see it. I think once you guys kind of see what I do, it's going to the light bulb is going to click. It's going to make sense. It's going to be like, damn, it's this easy. And it is that easy. And you'll see why I spend sometimes 2 to 4 hours in a household with someone. Because, again, I take my time with the people. I want to make sure that I'm putting them in the right position. And again, that's going to be a win-win situation for all of us. And so it's just about asking the questions, getting them to open up to you, and then knowing your products. Yeah,
I completely agree. And that's a huge thing. So being able to see a lot of experts do it at a high level. I mean, you're going to have Gary right there too, who's going to be, I mean, if you've seen his name on the leaderboard, you ever seen $450,000, close to $500,000 in final expense production, which, as we all know, is pretty dang hard to do. That is just tremendous. So if you want to do a lot with them,
that's awesome.
I can put together the roster of people that are going that I have as of right now, commitments. So Mike, you and I, let's get together. I'll send myself an email for that on the roster, and we'll kind of see who we can, pair people up with. I got 2 people. I have John, I got yours, and I got Renee as well. So who did I ask to unmute?
Hey,
John. Okay, go ahead,
John.
Yes.
Hey, Holden. Hey, Mike. So I got a question for Mike, because I noticed that last year during AEP, especially the first days of AEP, it seemed like you had everything stacked up to sell for Medicare clients. And so I think that part of that is that you do sales over the phone, do telesales. Is that correct?
Well, no, not really. When I write them up, I do the telesales, but I kind of changed my methods to fit in accordance with what EFIS wants, and where I go sit down with my clients. But I do things a little different during AEP. And that's right around the corner. So that's something that you want to make sure that you kind of start getting, staying on top of. First and foremost, AHIP, you guys can go get certified now. So if you haven't, go do it. You want to do it sooner than later, because before you know it, things are going to start piling up on you to do, because you want to make sure you get your materials ordered and all that stuff. And so that they're going to start coming out with that here real soon too. But one of the main things that I do is I make sure that I do a mail piece drop here in August. So I start pounding with mail drops in August. So that's just a month away. And then that way I have a steady lead flow come September. And then I start reaching clients in September. The thing is, though, you can't talk about the new product in September. You got to wait until October 1st. So what I do is, I know that they want to talk about Medicare. I find out what plan they're on. Again, the nice thing is no one sells hospital indemnity. No one. And so that's your in. They don't have a hospital indemnity. You sell them a hospital indemnity. You tell them why it's so important and why you're a better agent, because you know this. And then you let them know, I have something for you that will work. I think we're going to be able to save you, get you a much better coverage, get you more bang for your buck. And when you sell them that plan, then you schedule an appointment for October 1st or whatever. You kind of go over that plan option with them. You can do that by phone if you don't want to go out there and see them. I would, especially with gas prices, I would just do it over the phone with them. And then once you convince them of that, then you put them down for an appointment for October 15th. So that way, but you just make sure you let them know that you want to answer all their questions before that day, because all you want to be doing is writing up applications come October 15th. And you just start filling your day up with appointments. October 15th through I usually have them stacked up through the end of October. And then all the people that I know are going to be where I have to go sit down with them, that they're going to have a million questions, and they're a little bit more challenging of a customer. I'll schedule them for November. That way I can get all the people during the initial push and then worry about the other people afterwards. So
smart man. Proper preparation prevents poor performance. So that's the way to do it. Just stay ahead of the game and just make sure that you're preparing. I mean, that's all that it is in the end of the day, is you're just prepared. I mean, before the door opens, he is already so loaded with everything. He's not doing telesales. He's not doing anything different at all. He's literally just prepared for when that door opens so he can go out there and sell.
One other last thing that you want to do too, that I forgot to mention, is we all have a book of business. So target your book of business. If you don't have a CRM, or if you have a CRM, then you just put everyone that's 65 or turning 65. You want to send them out a mail piece, letting them know, hey, AEPs are on the corner. And most of you guys are new to this, so this is one of the benefits that we offer. If you guys need a letter, we'll send you out a letter that would work. I think a letter, but better than a postcard, works. And you want to handwrite the address on the envelope, because they open those like 90% of the time versus a postcard. They just toss them. So you want them to be able to open it. You want them to read it. And then you want them to schedule an appointment. So you give them a few different options to where they can reach you to schedule an appointment. And I don't know if you guys use Calendly or not, but you can give them a Calendly link if you guys do. Or, if you have a landing page, you can send them to your landing page, or if you have them call in or shoot you an email. Just, you want them to get an appointment on the books with you. So that way, you can make sure and service them, because that's a huge part. I think that most people miss out is your current book of business. Me, it's just about maintaining my book of business. I want to tell them about all the changes before somebody else goes and tells them. So,
and a creative way that's pretty cool, actually, that I just thought of as you were saying that, is when you're doing these letters out there, make sure that they save your number. You can write something in that letter, whether it's handwritten or not, just say, hey, please save my number, text me, when you get this card, so that way I know that you got it, so we can schedule an appointment, right? Because most of our clients do text message, not all of them do, but a lot of them will probably listen to that call to action and do that. And then it's like, boom, now you're kind of doing it. But obviously, like Mike said, be proactive, right? Fill it out, send the card in. Hey, what day do you want to meet? October 15th. They send it back in, right? What time? 9 a.m., 9:15, 9:30, right? Every 15 minutes, I'm sitting down with someone. And, we don't care about the drive time, but, maybe you can give them a window once you talk to them, right? I'll be there between 9 and 10 a.m. So, all right. So who we got next? Miss Renee, what do we got?
So he kind of mentioned the first question I was going to ask is, do we have like a standard letter that we've already got typed up for existing clients? Because I have, in my year of doing final expense and term now, I have tons of clients already. So I really want to go through all my existing clients and send them a letter in hopes of getting to them and saying, hey, there's all these new changes coming out this year. Talk to me, your life insurance agent, before you go to the next Medicare agent.
So what I would do when you're in that situation right there is I would send them out a letter like today, and let them know what you're doing, that you haven't, that you started a new position, that these are all the programs that you have to offer. This way, again, you're getting in front of them. And then in a month and a half, or like in mid to the end of August, send them out another letter, letting them know, hey, it's right around the corner. Let's schedule an appointment. So, again, now you're going to be in front of them 2 times, and they're more likely to call you.
Okay. And then just so I'm clear on the rules, as far as the Medicare appointment and final expense. So if I'm there with, for Medicare specifically, and I let them know, by the way, if it happens to be Medicare prompted as opposed to the vice versa. And I say, by the way, do you guys have any life insurance coverage? And if I can show you how we can save you, and they of course want some, but they can't afford it. And I'm able to, basically tell them, I can help you look at your Medicare plan. And if I can save you some money each month, we may be able to then go ahead and get you that coverage that you want so badly. And they absolutely want to talk about it right then and there. If I'm done with the Medicare appointment, am I able to continue with that?
Yeah. So basically, you have compliance aspect of it, Sue. So we definitely want to just maintain compliance, and that's an important factor. So you and I we'll go over that stuff. You and I directly will cover every single thing that we need to do to make sure that we're making sure we're in touch with the clients and we're doing everything that we need to do to stay compliant. And then I didn't want to lose this note real quick, because I just saw this question come in here, and Renee, you're just bringing it up too. I'll put together, Mike and I will put together kind of an example of what we do for a postcard, because that is really important. And staying in front of your clients is the most crucial thing, right? A lot of people, we let our clients go. We don't think about them. Maybe we were taught different. We were just leads and forget about them. Now I'm a huge proponent of leads. And I think buying 40, 50 of them are amazing, but staying in front of those people is even more important. So to answer your question for Renee and for Steph, yes, let's put together a sample card of what we do. And Mike and I, we're going to do an AEP Gear Up call, and we should probably do that the first week of September, I guess, and just do a call that's focused on it, right? If we want to get mail out, then in August, right, start dropping some mail for some people. You guys, 1, need to be saving for it, and 2, we'll start getting mail out the door to help everyone. So we could definitely do that. And do we have any other questions before we downset Hut and wrap up? Already, if that's about it, no hands raised, no one unmuted. I appreciate everyone's time, and you all have a wonderful evening.